Well, hello and welcome everyone to Medicaid 101, how it helps people with disabilities. Today, we're going to be answering some common questions about Medicaid, especially how it helps people with disabilities using plain language. My name is Demi Thomasides, and I'm the Paul Marchand Fellow at the ARC of the United States, and I'm also a Master's of Public Policy student at Georgetown's McCourt School of Public Policy. Kim, can
Great.
you introduce yourself?
Yeah, thanks, Demi. My name is Kim Mushino. I'm the Senior Director of Medicaid Policy at the ARC of the United States. My work here focuses on Medicaid policy and making sure people with disabilities get the services they need to live in their homes and communities.
All right, so to get us started today, Kim, what is Medicaid?
Medicaid is a program that offers health insurance to people with low incomes and people with disabilities. It's a partnership between the federal government and each state. It helps pay for healthcare and long-term services that you can't get from most other insurance. About 80 million people benefit from Medicaid in our country.
So who runs Medicaid then?
Good question. The federal government sets the basic rules and shares the cost with states, but each state gets to manage its own program and decides details like what services to cover and who qualifies within the federal guidelines. So because each state has so much flexibility to determine what populations and services to cover, how to deliver care, and how much to reimburse providers, there's significant variation across states in program spending and the share of people covered by the program.
Okay, and with that in mind, who can get Medicaid?
Well, eligibility is based on income, family size, and other factors. Many people with disabilities qualify for Medicaid. Some qualify automatically if they get supplemental security income or SSI. Others qualify through disability rules in their state. Some qualify through the Affordable Care Act expansion. This is based on income. Most states have expanded Medicaid. However, 10 states have not. Those are Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming.
All right, so Kim, how is Medicaid different from Medicare?
Well, Medicare is a federal health insurance mainly for people over 65 and some people with disabilities, regardless of income. Medicaid is income-based, based on how much you can pay and afford, and can cover services that Medicare does not, like home and community-based services.
All right, so what does Medicaid actually cover then?
Things like doctor's visits, hospital care, prescriptions, mental health care, school-based therapies, and for people with disabilities, long-term services and supports. That includes things like help at home, personal care, and services that help you live and work in the community. There are mandatory services and optional services. For example, the states must pay for things like health care, hospital care, and nursing homes. Unfortunately, they don't have to pay for many types of therapies, respite care, dental, glasses, and most importantly, home and community-based services. These are optional services that states can choose to provide.
Okay, so I've heard HCBS. What does that mean?
That just HCBS stands for Home and Community-Based Services. Those are supports that help you, they come to you to where you live, like help with bathing, dressing, maybe cooking, taking medication, getting to work, or joining in community activities. so that you don't have to move to a nursing facility or other institution to get support.
Okay. Could you give us some more examples of HCBS?
Sure. Home and community-based services can mean things like personal care attendance. It could be respite or a break for family caregivers. It can pay for supported employment so that you can get work but have on-job supports. It can pay for day programs like activities in the community, transportation for medical care, home modifications, assistive technology. Basically, states have options to provide a lot of services that help people live more independently.
All right, thank you. So then what about children with disabilities?
They are served as well. In fact, children get a very strong benefit called early periodic screening, diagnosis, and treatment, or EPSDT. What this really means is if a child needs a covered health services to stay healthy or to develop, Medicaid should cover it. This can include things like speech or occupational, physical therapy, or other therapies, as well as medical equipment and behavioral health services.
All right. So then what is a waiver and why are people talking about wait lists?
Good question. Many home community-based services are offered through waivers, which lets states provide services at home instead of an institution. States often limit the number of waivers, so in some states, people may have to wait to get services. It's important to advocate at the state level to make sure that people are getting services and that the waiting list isn't too long. You should try to get on the wait list as soon as possible, as soon as you're eligible, and then make sure you keep all your contact information up to date so that you know when you're going to get services.
All right. So how does someone apply for Medicaid then?
You can apply through your state's Medicaid office or go to the website. You can also start on the website at healthcare.gov, which will then route you to the right place. Local chapters of the ARC and other disability organizations can help with applications.
And what do people typically need to apply?
Well, if you have one, bring your photo ID, proof of income, documents that show where you live, any disability related documents if you have them. If you don't have everything, just apply anyway, and your state will tell you what's missing.
All right. But what if someone is denied?
You can appeal. Read the notice if you get one, and it will explain why and how to appeal. Deadlines are short, so you have to ask quickly on this. Ask for help from a chapter of the ARC, legal aid, or protection advocacy organization in your state if you need it.
All right. And then what happens if I move states?
Unfortunately, Medicaid does not transfer. You must apply in your new state. Waiver lists also don't transfer, so make sure you plan ahead and contact the new state's program where you move.
Could I work and keep Medicaid?
Often, yes. There are rules that let you keep coverage if you work. Many states have Medicaid buy-in programs, for example, for workers with disabilities. Talk to a state, benefits counselor to understand how work and earnings affect your coverage in your state.
Okay. So then what if someone already has private insurance or Medicare?
You may still qualify. Medicaid can act as kind of a secondary coverage. It may pay premiums, co-pays, and services that the other plan doesn't cover, especially long-term services and supports.
Okay. And how do people keep their coverage?
To make sure that you don't lose coverage, just make sure you're opening your mail, read texts or any emails that you may get from the Medicaid office, and respond to any renewal forms on time. Update your address, your phone number, and email anytime they change so that you don't miss anything. If you do miss a deadline, just reapply right away.
All right. So, Kim, why don't we do a quick lightning round to clear up some myths?
Okay.
Myth: if I work, I will lose Medicaid.
Many people can work and keep coverage.
There are many people on Medicaid who refuse to work.
That's not true. In fact, most people on Medicaid are already working. If they are not, it's often due to a chronic illness, caregiving duties, intermittent work, or discrimination.
Okay, Medicaid is the same in every state.
That's false. As I mentioned earlier, Medicaid is different in every state. The program even has different names in many states, like TennCare in Tennessee or Badger Care in Wisconsin. It's important to understand that all of these are Medicaid programs.
All right. Kim, to wrap us up, where can people go for help?
Well, you can start with your Medicaid office on the website, contact your local advocacy organizations for guidance. You can also reach out to your state's protection and advocacy organizations. Sometimes those are called disability rights organization for any appeals, or if you just need help with any complex or difficult issues.
All right. Well, Kim, thank you so much for doing this. Any final thoughts?
Well, we believe that everyone deserves the support they need to live in the community. If you need help, please just ask. There are many people ready to assist. Also, we need you to continue to help us advocate for the Medicaid program at both the state and federal levels.
Absolutely. Well, everyone, thank you so much for watching. Links are in the description. Have a good day.